Good afternoon. Welcome to the National Press Club, the place where news happens. I'm Lisa Nicole Matthews, 114th President of the National Press Club and Assignment Manager for U.S. Video at the Associated Press. Thank you for joining us today for our virtual Headliners Newsmaker with Mercy Corps CEO Tjada McKenna. We are happy to accept questions from our audience today, and I'll ask as many questions as time permits. To submit a question, please email headliners@press.org. Even before COVID-19, the world had some serious troubles. Syrian refugees fleeing nearly a decade of war had overwhelmed makeshift refugee camps in Jordan and Turkey. In Indonesia, tens of thousands of people were spending their second year in temporary shelters after a 7.4 magnitude earthquake destroyed whole neighborhoods and triggered a devastating tsunami. And in Yemen, continued conflict displaced 24 million people, creating what the United Nations called the worst humanitarian crisis in the world. In each one of these places and dozens more, Mercy Corps' global community of more than 5,000 humanitarians were at work, providing education for children with special needs in a refugee camp, delivering food, water, and hygiene items to war-torn Syria, rebuilding broken communities after an earthquake, and building clean water systems and food security in Yemen. Then COVID-19 struck, intensifying existing challenges and worsening food insecurity, conflict, economic and gender inequality, and unemployment. These were among the challenges facing Tjada McKenna when she became CEO of Mercy Corps in August 2020. Mercy Corps' teams work in more than 40 countries around the world, including conflict zones such as Yemen, the Central African Republic, and Syria, where it is one of the largest non-governmental aid organizations on the ground. But Ms. McKenna is well acquainted with that challenge. She has served as Chief Operating Officer of CARE, Chief Operating Officer of Habitat for Humanity, and has worked at the Bill and Melinda Gates Foundation and USAID. Today, Ms. McKenna will discuss the actions needed to support an equitable global recovery and what Mercy Corps has called on the Biden administration to do to address underlying issues such as poverty and climate change. Ms. Tjada McKenna, welcome, and thank you for joining us today. The floor is yours.
Thank you to the National Press Club for inviting me to speak today. It's an honor to address this historic institution at such a pivotal moment in the history of the world, and to be here alongside you, Lisa. Congratulations on your recent appointment as president of the Press Club. I'm excited for your leadership ahead.
Thank you.
As Lisa mentioned, Mercy Corps, we are a global team of 5,600 humanitarians committed to creating a future where everyone can prosper. We work in more than 40 countries around the world. When COVID-19 hit, our team members redoubled their efforts to support communities in need. Despite travel restrictions, supply chain disruptions, and the uncertainty we all experienced in the early days of this virus, Mercy Corps, together with our partners, adapted to continue to provide life-saving relief and critical development assistance, and to help communities protect themselves against COVID. Over the past year, we at Mercy Corps have reached more than 37 million people. From communicating timely and accurate health information about COVID-19 to over 9 million farmers in East Africa, to using 3D technology to produce face shields for local hospitals in Tunisia to protect healthcare workers, to providing clean water, soap, and other hygiene essentials to help more than 12 million people stay healthy and protect themselves from the virus. So before I continue with my remarks, let me just say a huge thank you to our team and to all the humanitarians around the world who work in difficult conditions and who have been working so tirelessly for the past year. And what a year it has been for all of us as we look at this one-year milestone. Every person on Earth has been deeply affected by these unprecedented events, but as with all things, not equally. Because just as we've seen, COVID magnifies pre-existing inequalities here in the US, The same is true, and even more so, beyond our shores. In fact, due to the presence of the pandemic, extreme poverty is on the rise for the first time in 2 decades. This time last year, 1 in every 45 people around the world was in need of humanitarian assistance. Today, that figure is 1 in every 33. So that's 235 million people around the world who rely on aid to survive, an increase of 40% from this time last year. Never before have we faced a humanitarian crisis of this magnitude. For millions of people, this pandemic has exacerbated hunger, poverty, conflict, and gender inequality, all of which have the potential to be equally or even more deadly than the virus itself. The World Food Program estimates that more than 270 million people around the world are either at risk of becoming or already are acutely food insecure because of COVID. The disruption of supply chains has led to spikes in the price of basic foods like grain and dairy at exactly the same time as millions of people worldwide have either lost jobs or lost their ability to earn livelihoods or are struggling to get by on reduced incomes. In South Sudan, the price of an average family's food basket has increased by more than 40%, leaving more than 8 million people in need of food assistance. When families can't afford to feed themselves, they resort to extreme measures, selling what few assets they have, like their chickens or their cattle, pulling children out of school because they can no longer afford school fees, even in places where schools are still open, or marrying girls away early to reduce the economic burdens on their family. Even as the health effects of the pandemic subside, hunger and poverty will be long lasting, and it will take time for these families to emerge from those conditions. The pandemic is also reversing progress towards gender equality. Women and girls are enduring the worst of this pandemic, suffering greater threats to their health and livelihoods than men, enduring an increase in physical violence, and shouldering more burdens as they care for family members. As we look ahead to the coming year, my team and I fear that rising hunger, poverty, and challenges for women and girls will be accompanied by a significant increase in violent conflict. COVID-19 is already worsening global conflict at every level. Armed groups are exploiting the pandemic, leading to an increased risk of deadly violence. Government responses to the pandemic, including lockdowns and border closures, are fraying community trust. Misinformation is proliferating, and competition for resources has intensified. It's a scary mix of conditions. In Colombia, progress toward peace was already flagging following the 2016 peace accords. Armed groups were filling the power vacuums left by the FARC. Initial findings from Mercy Corps research show that the pandemic has driven rural Colombian households to illicit crops like coca, reversing the downward trends we had seen before the pandemic. Farmers are being coerced by armed groups to either grow coca or abandon any plans they had to switch to legal crops. The economic ripple effects of COVID-19 also mean there are fewer options for farmers to get their legal crops to market. So when armed groups control an area, coca is more profitable and more reliable as an income source. We've also seen that school closures and a lack of opportunities for young people have led to an increase in youth joining armed groups. This again has reversed the positive trends that we were seeing in Colombia before the pandemic, where the recruitment of young people to armed groups had been falling. Around the world, our teams are also seeing that the very measures designed to prevent the spread of COVID are inadvertently fueling violence in some countries. In South Sudan, communities have told us that lockdowns and movement restrictions are undermining traditional methods of addressing and resolving disputes. So these are the gatherings where communities have commonly dealt with issues from theft to allegations of sexual assault. And without them, very serious tensions are left unresolved in these communities. In Northwest Nigeria, COVID-related closures of the border with Niger have increased unemployment and reduced trade for border communities, making it harder for farmers to get their food to market and for families to buy the basic supplies that they need. Communities tell us that this has strengthened armed groups who have exploited rising economic hardship and grievances to recruit new members and collaborators, which in turn has fueled a spike in kidnappings, including of school children, as I'm sure we've all seen reported by you over recent weeks. These challenges are widespread. In fragile countries, COVID has magnified the challenges that already existed to the cost of their populations. And not surprisingly, these are the same countries that are at the back of the line waiting for vaccine access. Of the 20 countries worldwide that saw the highest levels of violent conflict last year, only 2 are projected to achieve widespread vaccination of their populations by the middle of next year. So the remaining 18 countries are unlikely to reach widespread vaccination until the start of 2023 or even later. The longer these conflict-afflicted countries wait for vaccines, the greater the risk that violence will increase and that hunger and poverty will worsen, making it more difficult and more time-consuming to recover in the long run. The challenges are immense. So how together can we meet this moment? I don't want to end on a feeling of hopelessness, because we are certainly not hopeless. First, we must fight for COVID-19 vaccines to be distributed equitably around the world. This is critical to ending the pandemic and beginning recovery. Yet, higher income countries continue to secure agreements for vaccines above and beyond what's needed for their populations. Residents of wealthy and middle income countries have received about 90% of the nearly 400 million vaccines delivered so far. At Mercy Corps, we are urging the US and other high-income countries, as well as pharmaceutical companies, to take concrete action to address vaccine inequity and ensure vaccines can reach everyone, everywhere. Many higher-income nations have stepped up with generous contributions to COVAX, but money doesn't address supply and production issues. You can bring money to a grocery store, but if the shelves are empty, you'll leave empty-handed and hungry. Wealthy countries that have purchased excess vaccines should donate those supplies through COVAX as they become available and take action to boost vaccine production. We also need a strong collaboration between governments and global health actors to ensure that people living in conflict zones and other hard-to-reach areas are not left out of vaccination efforts. This must include vulnerable populations such as migrants and refugees, or populations within countries that suffer discrimination. Beyond ensuring access to vaccines, we must make sure communities around the world have trust and faith to engage in their public health systems when vaccines do arrive. Action to create vaccine acceptance is needed now to lay the groundwork for successful vaccine rollout. Building public trust will require an enormous united efforts from governments, public health officials, humanitarian groups, civil society organizations, the private sector, and local community leaders. We need deep and inclusive community engagement to build trust in public health systems, as well as the vaccines themselves, particularly after so many have seen their public health systems and their government struggle to contain the vaccine. And while successful global vaccine rollout is critical, it is not a cure-all solution for post-pandemic recovery. Along with vaccines, we need sustained assistance to prevent millions more people from slipping deeper into poverty and hunger, and to prevent the unraveling of the development gains we've worked so hard for. Unfortunately, foreign assistance is not keeping pace with the ballooning need we see across the globe. Only 1/3 of 1% of US COVID relief thus far has gone to global assistance, Nearly all of that money, all of that small 1/3 of 1% of US COVID-19 relief, nearly all of that small portion has been for medical relief and vaccine distribution, with little support for the devastating economic, social, and other ramifications from the pandemic. Mercy Corps, we have joined along with more than 70 international NGOs in calling on Congress and the White House to support a comprehensive global response to the COVID-19 crisis, not only for global health, but also for humanitarian, development, and conflict prevention work, because conflict prevention programs work. Mercy Corps has consistently found that they enhance security and promote stability that can break devastating cycles of violence. These investments are more critical now than ever. Mercy Corps worked with Congress to pass the first ever peace-building law, the Global Fragility Act, and we need to make sure it is funded to address the violence emanating from the COVID-19 pandemic. The difficult truth is that for many people around the world, the worst effects of the pandemic will only be realized in the years to come. At the start of the outbreak, when one of my colleagues met with a West African woman, she asked, "Am I supposed to let my family get hungry because of a cough?" Right now, millions of people around the world are asking the same question. They're being forced to choose between their health and feeding their children, their health or sending their children to school, their health or going to work. Millions of people will need significant support over the next several years to rebuild and to prevent mass hunger, extreme poverty, and violence. The time to rise to the occasion is now, and we must do so in a very sustained way. If we do not take action, hundreds of millions of people will suffer as a result, not only now, but for years to come. But if we work together and start now, we not only help protect our neighbors from the worst of COVID-19 impact, but also ensure a brighter future for all of us. So thank you. I will end there, but thank you for allowing me to share those words.
Okay, so much to unpack.
Mm-hmm.
And I'm so glad that we have you today, Tjada, because it's, I think that in our country, we tend to concentrate on us.
Yes.
And I don't know how many people have been thinking about the fact that there have been people around the globe who have literally been thrust into yet another crisis that is completely out of their hands with COVID-19.
Yeah.
So thank you again for joining us today. So I have a lot of questions for you. So you said, well, you said a lot of things, but you said that only 2 of the most conflict affected countries in the world will have widespread vaccine access in the middle of next year, which is horrible.
Yeah.
How will the other 18 countries that you mentioned get access to the vaccine? And you said that you're calling on the Biden administration to do more, but what more can they do?
Yeah, and just many countries, including those, the ones that you're talking about, we're estimating that they won't see comprehensive vaccination until 2022 or even 2023, if at all. So, the U.S., we don't oversee vaccine distribution outside of our borders,
Right.
Though we do have excess supply of vaccines, kind of leaving these countries further back in line to get the vaccine. COVAX, which is the global collaboration to ensure equitable vaccine distribution, has done an admirable job, and they've distributed, I think, over 31 million doses to 57 countries. Countries receive shipments every day, and COVAX aims to vaccinate 20% of the population in the participating countries this year. But for it to really live up to its promise, there needs to be funding to further funding to support its ability to purchase vaccines, further efforts to free up the vaccines that are already out there, and we need to continue to boost production of vaccines globally. So even though we did that to get the vaccines that we need to make sure that's being done for the whole world's population, because we're all at risk of relapses or other COVID things until everyone's vaccinated, as we've seen.
So what about, I'm going to bring you into like the reality of today. I mean, we've got vaccine hesitancy here in the United States.
Yes.
Talk about the impact of vaccine hesitancy on the ground in places like Central Africa and Syria, and what the envoys actually do on the ground to convince folks that they need to be vaccinated.
Yeah, it's interesting because there are a lot of ways in which what we're seeing here in the U.S. it's all more relatable now when we talk about what's going on in other countries, and that's very sad, but it's true. And the misinformation, some of it's emanating from the U.S. or from China or for Russia. This is a situation that's even more dangerous if you are sitting in the Democratic Republic of the Congo, or if you're sitting in the Central African Republic. You already have a failed government that's not providing a lot of your needs, and so you have this disease, may not have testing, may not have things for it, and so the misinformation. We've heard all kinds of crazy things from people feeling like COVID-19 is an excuse for governments to just get more power or to use more money, or to bribe people, to things that only certain populations get it, or blaming it on like migrants and refugees coming over. What we learned from our work in Ebola was that the only way to break through that misinformation is to work really closely with local communities and to engage them in efforts and to go to local communities. We can't just stop at government. And so we have to make sure that we are funding an effort. Like COVAX only buys the supplies, right? And the governments, we have to make sure that we are funding an effort and that we are working together to get to every single community, especially the hard to reach ones that don't trust people, to provide information and to combat that. We've been using some technology and other things to try to combat misinformation. So in northern Nigeria, we have a rumor tracker so that we are tracking what the rumors are, and we're like using radio ads and text distribution to specifically address those specific rumors to try to take things down one at a time. We also have in East Africa, we have some digital networks we use to send farmers things like the weather. We've been sending them COVID information materials on those as well. So it's really something to be aware of, and that we have to actively be preparing for and combating now.
That's a great tactic. It's something that we could probably use over here. It's unfortunate, but that's really cool and interesting. You mentioned the Global Fragility Act. This is the first time I'm hearing about this. What is it, and how should it be implemented by the Biden administration?
Yeah, it's actually great timing that it came through. So the Global Fragility Act is new. It is bipartisan legislation that focuses U.S. foreign assistance on preventing violence and conflict in fragile countries. And in December, just a few months ago, the U.S. government released a U.S. strategy to prevent conflict and promote stability. So, which was the first requirement of the Global Fragility Act. So now it's important that the Biden administration build on that foundation. Began providing programmatic support to priority countries this year. Congress can support this implementation by making funding available for it, and also by making sure that the U.S. government moves forward with the law's requirements. So that includes setting priority countries and beginning programming, and that's also specific implementing agencies should also be consulting with the communities around peace building activities in those communities. And finally, we're also calling for the government to really make sure they're testing and refining evidence-based programming. So putting in the right research and learning into our programs so that we can do this well for years to come.
Okay.
Because it's a wonderful preventative approach.
Well, it's nice to hear that we could get some bipartisan agreement on something as serious as needed as that. I'm going to take a question from the audience. Is Mercy Corps considering a model to elevate country directors, and I'm reading this off of my phone, so bear with me,
Mhm.
country directors in decision making to support the concept of decolonizing global development. I know that that's a pretty heavy situation in many places, and particularly in Africa.
Yes. One of the things, it's long overdue, but one of the things, the aid sector, unfortunately, has a long history of neocolonialism and white saviorism, where local organizations and communities played a backseat role in the aid and recovery processes. And as a result, we're kind of like told you need this, or just had things brought in. And those things ultimately don't work. So as a sector, we have to confront our history and do better to create those conditions where local communities really are the drivers. They not only have agency and power, but they have the power. We need to cede certain power to them. They need to be the voice. We have, where possible, not where possible, we are increasing. One of our goals is to have all of our country directors be from like the regions or nations where we serve. Like there are some situations like in conflict where it's hard to do that, but that is one of our goals, and we continue to do that. But we also have a wide variety. Our staffing, we have really well thought out gender, ethnicity, diversity goals within our team staff to make sure that our staff are from or represent a diverse set of the local populations to work with community organizations. And we do a lot of work extensively with community civil society organizations, with local nonprofits, with local governments. So we're very committed to that, and certainly our country directors are part of that. It's also interesting in this conversation of neocolonialism. The old model and the industry was built on frankly white men from Europe and the U.S. like going to these countries to do the work. And when we look at our own international staff populations, the largest numbers of them are coming from countries like Kenya and India and Nepal. And so it's interesting. I think that's starting to happen. It's not that mentality of white saviorism, that really embedding power in local organizations is quite important. But it's a much more diverse cross-sectoral map that we're seeing on the issue.
Interesting. So talk a little bit about, what your teams on the ground had to do to adjust to the pandemic in terms of, engagement with people, and I mean, all of the protections they had to take for self.
Yes.
Before they could help others.
Yeah, no, I think like everybody, we were kind of thrown back on our heels. And it's interesting, like there were some cases where we had to like stop and take a pause or stop traveling or stop doing things. But in a lot of countries we serve, when we would talk to our country directors of the team, it's like, you know what, this is just another thing. I have a locust outbreak. There's a cholera outbreak in the community. Like there's all kinds of stuff going on. We're not summing. So we made adjustments to our programming. And so some of them are little and small things like smaller meetings, like when we do food distribution points, like smaller numbers of people in lines, more timed entries, where we support cash and vouchers, like digital distribution of those cash and vouchers, getting supplies to ourselves, like doing proper spacing in our meetings with people as we go to communities. Some other things are adapting our programming where we could. So there's a situation in Jordan where we worked with a local organization that provides like audiobooks with lessons for girls' education that could be done over the radio. So a way to kind of still give people those essentials without them having to travel. And so I think we've adapted our working methodology. It's pushed us to be really innovative and creative. There are times where we do have to like hibernate if an outbreak does get out of hand. But for the most part, our teams are still out there providing support. We also were able to mobilize, we work with a lot of women's groups or producer organizations or small businesses. And in the early stages of the crisis, mobilizing those businesses or those groups to make masks and the different things like retraining them to make things available for the community are also really critical in helping those communities mobilize to help themselves right away.
You mentioned women. Can you talk about how the virus, how COVID-19 is affecting women and girls in the countries that Mercy Corps serves?
Yeah. Like in every situation, there are shocks or crises that can affect every person in every country. We know they do not affect them all equally, and sadly, almost everywhere, women and girls are left behind. They suffer the worst in shocks and crises, and their needs are not met in those situations. So we are seeing that women and girls are enduring the worst of the pandemic across every sphere, from poor health outcomes to a lot of women are employed in the informal sector, right? So they rely on going to markets or going to do household work. So they've had real livelihood losses and earnings losses. Then there's increases in physical violence towards them, increased care burdens at home. Many people live in multi-generational housing. And obviously we've talked about the lack of schooling and how school closures have affected girls especially. The UN has projected that the poverty rate among women would increase by 9.1% because of the pandemic and its fallout. So that's really sobering. So I think and organizations like ours, what we really work to do in situations like this is to make sure that we address needs specifically of women in times of crises, because often, as we've seen, even in response teams for governments, it's usually a lot of men standing at a podium.
Right. Yeah, I was going to say there has to be some.
Yeah, people are thinking, how do I get women their menstrual supplies? Or what?
Right.
So making sure that we put them at the front of our thinking, because they are often left. So for instance, our team in Ethiopia recognized a spike in unemployment for domestic workers who are predominantly women. And so we partnered with a mobile app there, Task Mobi, that matched service providers with jobs and helped hundreds find work. We also had donation funds for domestic workers to help people in need. And I mentioned also that example in Jordan, where we partnered with a company that produces Arabic audio books to then have lessons over the radio so that girls weren't losing all those gains. So it's really important that women and girls are at the forefront of our responses, because they suffer the worst of incidents like these. And sadly, I've never seen one where they didn't. And that it's a heartbreaking facet of things. Also, we're also working really hard to try to reduce, we're seeing an increase in child marriage as a result of this. And so we're really doubling down on our programs where we educate families and the in-laws that would take them in about the benefits of waiting and then the benefits of delaying pregnancy if those girls do enter the families at a young age.
Something else I'm wondering, climate change. Has that impacted how Mercy Corps operates around the globe at all?
Yeah, so climate change has been one of the things that we've been that's been impacting our work for a long time, right? Like farmers, when we work to provide, and most of the poor people in the world are actually rural and farm on lands, and they were noticing, the dry season's coming earlier or this, and so we've been working with people to adapt, but especially around things like water, sanitation, and hygiene. We're really doubling down on things that are affected by climate, like access to water for hygiene purposes. And the climate is one of these, it's just another thing that's exacerbating this competition for resources, right? That the pandemic has put on such big display. And the climate change is the reason for a lot of displacement to begin with. So as we see kind of more of this stew of other things contributing to violence and insecurity, climate change still remains there, making it even harder.
I think one of the most fascinating things since I've been checking out Mercy Corps, since we set up this interview, is just how long you guys have been working in Syria, of all places. I mean, it's one of the toughest places around the globe, even for my news organization to get information out of. It's been 10 years now since the war. Can you talk a little bit about the whole situation in Syria and how Mercy Corps has, I guess, kind of worked around it and within it?
Yeah, and I actually, my first call of the morning this morning was with our Syria team. So I'm really happy to be able to talk and share some of the things that I learned this morning that we've been talking about. One thing that's really sad about Syria, and we saw this there with Iraq. So like at the beginning of the crisis, there's a lot of global attention and funding to places like Syria and Yemen. But even before the pandemic, we saw those numbers and that support flagging because there's just a fatigue, or sometimes a new crisis pops up. So those resources were already flagging, and we continue to see some governments are reducing their foreign aid, and that's hitting places like Syria the hardest. Since COVID, the bulk of the resources have gone to the health response, but we just are not seeing as much as we need for the humanitarian response and some of the secondary impacts that are coming. The other thing that's going to be challenging in Syria is that there are several different there are places that are in government control, and there are several places that are not under government control. And the COVAX facility was set up to work with governments. So the government of Syria is going to be responsible for distributing those vaccines, but there are a lot of places that are not government-held areas, and COVAX does not come with money to distribute to organizations and people working in those areas. So we really are hoping that the World Health Organization will lead to making sure that they're doing that. Our team in Syria, we have been there for 10 years, and we have really shifted our mindset there from an active humanitarian need to really helping people to build for the future and building that resilience for the future. So giving them the tools and the skills that they need to thrive and to be able to create strength where they sit right now with economic development opportunities, with better farming, with other things, but also hoping that ability to earn income and to build assets in this period will also help to increase their own personal resilience as this crisis goes on. So, their immediate needs, but really supporting the population to live into the future despite the circumstances is where we are. And we hope to continue that work. And we hope that, we hope that the world will not forget about it, because it's just been as devastating and deadly as anyone can remember in recent memory.
I was kind of surprised to hear, and maybe this is just my not knowing, but you mentioned Colombia as a place that Mercy Corps is active. And I don't think that most people think about aid agencies operating in places in Latin America. Everyone always thinks it's over there. It's over there somewhere. Can you talk a little bit more about what you do and what Mercy Corps does in Latin America and the places impacted over it?
Yeah, I'll talk about Colombia a little bit, but if you think about the history and the arc of Latin America, you have seen in Colombia, especially, we talked about the coca production. So like we were in there doing things like helping farmers with alternative livelihoods before that. Then you also have like armed conflicts within countries. You have displaced people who've like left rebel-held territories and things. So for years, we've been working with displaced populations in Colombia, like internally displaced populations or people kind of recovering from the war with the FARC. And then since the Venezuela crisis, we've actually been actively helping refugees be settled in Colombia from Venezuela. And I think when you look at our work in Guatemala and other countries, it's the same. One, we're working against extreme poverty. So it's not just always emergencies, really helping to increase incomes in those countries and to produce economic opportunities. You see a lot of Central America has some pockets of really severe nutrition issues that we help to address in children. And within a lot of these countries, you still see the indigenous populations tend to be worse off or more marginalized and need that support. So we're really in the business of trying to make sure that everyone in these societies can thrive and to create better livelihoods for people, to whether it's to avoid coca production, whether it's to help communities not feel the need to have to migrate. But Latin America has long been a place of really important work for us.
I'm going to ask you to weigh in on a news issue, since we're talking about Latin America and folks not feeling the need to migrate. What do you think one of the solutions could be to what we're seeing happening at the U.S.-Mexico border right now?
Yeah, we're really strong advocates, and that's where the Global Fragility Act, with getting to the root of the problem. And most migrants, when you talk to them, and there have been lots of studies and lots of interviews, they don't want to, they're migrating for economic reasons or because they feel unsafe and insecure. And that gets to the core goal of what we're trying to do in countries like Guatemala. We're looking at providing like youth employment opportunities and education. We're looking at conflict prevention, right? And different things to engage youth and others that are likely to become in conflict. Also working with civil society around like safe spaces for people, and really just the bread and butter of like economic growth opportunities, whether that's helping people to become like small shop owners or dressmakers or tailors, or helping farmers have more access to food and more nutritious foods. But anything we can do to increase stability and to make those places safe, productive places where people can live really will help with that situation at the border. And it's long term, but it just requires that investment and those commitments.
Is that something that you think that the federal government should be more involved in, more directly?
Yes, we are very hopeful, and we're encouraged by the Biden administration and hope to see more. While also, I think the Biden administration understands that this is a two-front situation. You have to address the situation at the border immediately, but you have to also address the conditions that created people moving to the border in the first place. And development assistance is a key component of that part of that equation.
Okay. Well, we talked a little bit about policy. We talked about Mercy Corps in general. Let's talk a little bit about you. I'm curious, what drew you to this field? I mean, you obviously have a bucket load of experience in crises. I mean, they could not have picked a better person to lead Mercy Corps right now with all the experience you have. But I asked you at the top before the interview started if you had done Peace Corps.
Yeah.
Tell us a little bit about how you found.
How I came into this. I coming out of college, I didn't even know this was a field or thing that I could do. I was like, okay, I go to law school, I go to business school, like what do I do? But I volunteered. There's an organization called Operation Crossroads Africa, which is a precursor to the Peace Corps, and I was able to spend the summer volunteering in a rural area in Southern Africa, and I enjoyed it. And we traveled to another area, and I saw a woman who looked to be my age, and she had a baby that was trying to nurse, and like the woman's breasts were shriveled, and the baby kept like patting at the breast and trying to get more and more milk, and that was the first time that I realized that I was looking at hunger in its face, and that stuck with me, and I figured out I had plans to pursue a corporate career, and I did, but I found opportunities within that to start working on hunger issues and hunger issues in Africa, and one thing led to another, and here I am. So.
Wow. What are you doing at Mercy Corps specifically to improve gender equity and inclusivity? It's something that I talked a little bit about in terms of inclusivity at our club, but it's a very different thing on a corporate level.
Yeah, and we're really taking two tacks against it. Like I said, it's one of those things that our whole field needs to get into, and needs to work on. So one of the things, there's one side of it which is in our programming side. So when we do actual working with communities, we're very focused on social inclusion and belonging in that work, and supporting women to take leadership roles in their communities and through our programming. But outside of our bubble for our own staff, we have set we've set diversity commitments. We've made public targets for what we want our staff to look like. We have a really strong diversity, equity, and inclusion strategy. We have diagnostics that each team and each country program are using to understand like what are the diversity components and how they're doing in their context. We've launched an internship program with historically Black colleges and universities, and we are expanding that to partner with Latinx and Hispanic serving organizations. And we also know that we need to speak out holistically. So we, right now we're seeing a surge in violence against Asian Americans and Pacific Islanders. And we're making sure that it's not just people of Asian descent speaking out about that. We are speaking out about that. We're talking in our workplace about it. We're giving people resources to read about it and what they can do to stop it. So we really are, we feel like promoting this internally is part of creating a safe workplace, and it's part of creating a smart workplace that will have better outcomes. And we all have challenges, but we all have challenges in this area and can do better, and we're very focused on that. And I mentioned to you that I didn't know this field existed, so I'm particularly excited about the HBCU and Hispanic serving institutions thing, because it is important that from a younger age, people understand that this is a field of work that people can go to, and it means a lot for communities. It means a lot whenever I go into a country. It means a lot for communities to see a woman in the workplace in this way. And for me personally, I've been touched by how many people have been touched by seeing a Black American woman show up in partnership. And it makes everything, having that kind of diversity and representation, it just makes us better at what we do.
So I have to be the kid in the audience who's going, okay, so what did you major in? And how long did it take you to get there?
Yeah. So I was a government major in college. I went to Harvard. That's their fancy name for political science. I grew up in DC. My mother was a Fed employee for a long time. I love political science. I went to business school. I was pursuing a business career. And I have found that to be so valuable, because a lot of large companies have resources to provide training that I wouldn't have gotten otherwise. And like training in speaking or leadership. And it also gave me like a financial and a business perspective to be able to oversee an organization. There's like so many different parts of an organization other than the program work. But also one of the things that's really fascinating is like the private sector, there's so much overlap, or so many ways that the private sector is engaged in development work. So our farmers in Guatemala, like Walmart needs to buy vegetables from those same farmers, right? So I think understanding some of it from a business perspective has also helped me on the program side, when I'm like, okay, what do farmers need to sell locally and to sell to big companies, and how do they help them? So I mean, there's room for lawyers in this field. I think if people pursue their passions, obviously we all have HR professionals, we have government policy, like it's like all kinds of types are needed to do. I need finance people, like all types are needed to do this work well. So really exposing people to kind of what the work that we have, what communities that we serve need, and how that can help. And then we try really hard to partner with private sector and with other actors as much as possible to just like bring the best that we have to bear on this work.
I'm wondering, is there any competition factor between Mercy Corps and like other groups like the Red Cross and things? I mean, that may seem like a crazy question, but you just never know.
It's not like in the corporate sense. We work together all the time, and we talk to each other all the time. We do compete. So if there's like a USAID grant to run a program, like we're competing to get that grant. We also partner to run programs. Like we know what we're good at and what we're not. And we often have to come together both to like help each other understand situations, to advocate together, to do things. So we are a sector that tends to work well together, but we also are all still competitive and want to be the best and want to have our own bragging rights.
So another personal question, what was it like for you to take the helm of the organization, I mean, during the pandemic, and what advice do you have for future leaders or leaders of other organizations who've had to overcome the hump of what is COVID-19 and handling managing the outlook for their organization?
I've always personally followed this philosophy of servant leadership and trying to figuring out like where am I needed most and kind of volunteering for that. In the middle of the pandemic, when my kids were home from school and we were pulling our hair out, the headhunter called about this role, and I, it's like this is the time. It just seemed impossible to even carve out space to interview for it, honestly, with the kids on the front. But at the same time, like, because I was in this work, I was like, this is the time when the world needs our organizations more than ever, right? Like the communities we're serving are suffering even more, not to make it the pain Olympics, but even more than we are. So, so how can I serve? And so I threw myself into it. So it's a unique situation. I have actually reached out. I've found a few other like COVID CEOs, I call us, like we I was recruited entirely through the pandemic. So I really have not met in person my board or my staff. I've never set foot in a Mercy Corps facility. Luckily, we're all in the same situation where we're all virtual. The organization has been super welcoming, and I think also in a lot of aid organizations, it's like we were built for times like this. We've done our best work in times like this because that's our DNA is around serving and helping people. So I guess as leaders, it's like, self-reflection coming in. I realize I realize my staff is tired. They're exhausted. They have kids at home. I think being human in this point is the most important thing as a leader, and kind of setting those aspirational goals and motivating people, but really understanding what your staff needs to do its best work. And being adaptive. And I do feel like I'm coming to Mercy Corps in the best of times in some way, because people have just had to be really flexible and adaptive and tolerant and patient. And it's just been an honor to be able to go through this journey with this organization at this time.
I'm curious, what are the toughest areas for you? And this may seem like a ridiculous question because everything is tough. Yeah. And everywhere is tough, but where are the pain points in working at Mercy Corps? And are there particular areas that you're like, not this again? Or why do we have to continue to deal with this? And we've been down this road before.
Yeah. One of the things we talk about a lot internally is resilience. And that's part of what and I think that is coming from a humanitarian place of like, how are we back here with the famine? We were here 20 years ago, right? And like making sure that we are leaving a sustainable impact. So I think for us, that's why in Syria, I talked about Syria earlier and how we're pivoting from like this immediate humanitarian needs to like, what next? How do we give people the means to thrive and excel in their situations? And for example, there's an example that we have in Nigeria where there are a lot of people that are displaced internally and forced to move, because of different terrorism things. And we've introduced like poultry and chickens because if they move, they can take their chickens with them for food and income and assets. So I think the places that are heartbreaking for us or that are hard are places like Syria and Yemen, where the global community is tired and just thinks of it as a problem. And we see there are still needs there, and we see the possibilities and the opportunity. So look at having people, like kind of encouraging people to still continue to fund opportunity and hope, even when there isn't a political situation. And we just continue to focus on resilience because we want to be in the business of helping to build communities and build better lives, and not just fixing when things fall apart. And hopefully, with climate change and just the level of conflict we're seeing in the world, people are going to continue to feel shocks. And I think even us in the US, as we start to recover from COVID, we're going to think about, okay, we didn't have that savings account that we needed before when this hit and I lost my job. So what do I do? And so making sure, like, as much as we can do to keep people better prepared for the next one is where we are. But I think for us, the one that's most heartbreaking is when people are like forgetting about really vibrant, wonderful communities of people that are in need and that can be thriving with the right support.
I'm guessing that there are some people listening to our conversation right now, and they're wondering, well, how can I make a difference? You guys have been talking about the feds making laws and getting money from the federal government, but, I just go to work every day, but I do care. How can I get involved, and what can I do?
So I will, I'll make a pitch, but so I would encourage people to really like get involved with Mercy Corps, and that can start with a visit to our website at www.mercycorps.org. So MERCYORG.org. And I say to start there, I think one, building awareness, right? Understanding what's going on around the world, thinking about how things can impact other people. Two, there's all kinds of advocacy people can do in their local communities with like their local senators or representatives of Congress to say, I want to make sure people aren't left behind. And on our website, we talk about specific laws or acts that'll be helpful. And three, we ask people to donate where they can, right? And so obviously I prefer you donate to Mercy Corps, but it's really important for organizations like ours to have funding, like, to do things like to do the monitoring and evaluation to make sure that we did good work, and that we learn the research from what to do better next time, or to make sure that we have like compliance investigators, or to make sure that we can do like a community accountability to help communities hold us accountable. Those are all things that we need support to do. And so on top of the actual work, that there are other things, and we welcome that support. We also welcome people's time and talents. We've had pro bono support, and we've had lawyers that have helped us with legal things. There are always places to contribute, and we're always looking to engage more people in this wonderful work.
Okay. Well, before I ask the final question, let me take a moment to thank the organizers of today's event. Headliners co-team leaders Donna Linewan and Roy Russo. Today's headliner event coordinator, Tamara Hinton. Club Communications Director, Lindsay Underwood, and Club Executive Director, Bill McCarran. I also want to give a shout out to our folks that work behind the scenes in what we call our Broadcast Operations Center. We would not be able to do any of these presentations without them. So, and I also want to tell the audience about some upcoming National Press Club headliners. Tomorrow, March 26th at 2 p.m., Agriculture Secretary Tom Vilsack will join us to speak about his priorities for USDA and why he returned to a role where he had already served 8 years under President Obama. And on Tuesday, March 30th at noon, former White House Press Secretary Dana Perino will discuss her new book, Everything Will Be Okay, Life Lessons for Young Women from a Former Young Woman. And I have to tell you, I've read the book. It's going to be a fun discussion with Dana. So we hope you'll join us. And now for my final question. And I kind of alluded to this before we started talking formally, that this has just been an amazing year for Black women and for women in the United States in leadership roles. And I personally am just amazed to see you in this role, and very proud to see you in the role. And we're seeing women of color breaking through barriers perhaps as never before in this country, bottom line. You're the only Black woman to currently lead a major international aid organization. Yep. Kamala Harris is our first vice president, and also she's Black American, she's Asian American. What does this moment mean for young women and young Black women, and what advice do you have for them? Because this is an amazing time.
I hope that this means younger Black women will not think twice about their abilities to rise to these positions and to just take over the world. And I hope that I will see more people of color as my peers in organizations over time to come, because the populations that we serve in our work, more of them look like me than not. And so I think it's quite important to have those different voices there. In terms of advice for young women, I think where I have not done well in my career is where I did not really pay attention to an organization's values, or went to a place where my values did not align with it clearly. And so I think it's really important to really understand the values and the culture of a place so that you can truly be your authentic self and have the greatest impact, especially as a person of color, where you're going to have to take control of your own career development and seek things out. You want to be doing that and giving your all in a place where their values align with your goals. And I'm fortunate in this work. We spend so much time at work these days. I'm waiting for our society to rebalance a little bit there. But I'm fortunate in that I love the work and I love the values of the organization. And so it feels like joy still, and that has allowed me to do my best work. But if I'm in an organization where I don't have the same values, when I try to fix my problems there, we're not coming from the same place as to why it's a problem. So I just would encourage women to think about it. And like I said, just please don't put any barriers on yourself. I have young children. I mean, obviously you have to pick the right solutions and do things that work. But I do think we can do all the things we want to do. It might not be in the order that everyone else does them. It might be a marathon versus a sprint, or it might be a sprint and then you stop and do other things. But I just encourage people to think big.
Thank you. Thank you so much. It's wonderful to have you, Tjada. It's Tjada McKenna, President and CEO of Mercy Corps. Thank you so much for your time.
Thank you for having me.
Thank you for your selflessness, and good luck with the continued work on the ground in so many countries with the virus.
Awesome. Thank you so much. Thank you for having us, and I hope you guys will join us in our work.
We absolutely will. Thank you.
Thank you. Bye-bye.